Good morning. This is Rick Mason, a safety and health consultant with the PA OSHA consultation program. And this morning, I'm going to talk about OSHA's revised injury and illness tracking application. During this webinar, if you have any questions, the chat is open. You can simply type a question into chat. We'll try to answer your questions live as they come in. If we don't get to your question during the course of the webinar, we'll post the answers to any unanswered questions on our website within 7 days. Also, this recording and the PowerPoint will be available on our website shortly after the webinar. Okay, so today I'm going to talk about three basic things: the revised app process for online injury tracking, the online injury tracking application. I'll talk about data submittal requirements overview, just whether you're in or out of the program. Nothing has changed there. So if you're just looking to how to do the new login, when we get through the first section, you're going to have what you need. If you have some questions about who's in and who's out of the program, we'll cover that secondly. And thirdly, while we're on the topic, I just want to talk about some general requirements for recording injuries and illnesses and common errors we safety and health consultants see with our clients. Okay, so the new process of online data submittal, OSHA's made this very easy. They just announced fairly recently that this year, instead of logging in on the OSHA site, as you've done in the past few years, they're using the universal login at login.gov. So all current and new account holders must connect their ITA accounts to a login.gov account. You have to use the same email address, and you have to do that for this year's submission, your 2022 submission, which is due by March 2nd of 2023. OSHA has created a nice guidance document, and all the links I talk about in the program are on a useful links page at the end of the presentation. So any of these links are going to appear for you again. Okay, the guidance document and how to connect is here. They've created a nice video. I have a link to that explains the process, and they've provided answers to frequently asked questions at this link shown here. Okay, so create a login.gov account. The OSHA injury tracking is requiring you to do this for 2023 with your 2022 data. Login.gov allows the public to access participating government applications using one account for all included governmental agency applications. So you may already have one of these accounts. You must use the same email address for your login.gov account that you use to access the ITA now through OSHA to connect the two accounts. If you already have a login.gov account with the same email address, select the sign in with login.gov on the injury tracking login application screen. So it's really quite simple. 9 steps to create a login.gov account. Okay, select the sign in with a login.gov on the injury tracking application. You can go straight to the injury tracking location at osha.gov/injury reporting/ITA. So that's the easiest way to access it. You'll be redirected to the OSHA ITA login.gov sign-in screen. You just select create an account, and just a reminder, you have to use the same email address for your login.gov account that you have been using for your injury tracking app account on the OSHA website. So when you go there, the screen looks like this. If you don't already have an ITA account, if this is new to you or you've grown or you're a new business, this online injury reporting just phased in 2017 and 2018. And we consultants still are finding clients who are not aware of the reporting requirement and not doing the online reporting. So you can create your own account, or you can sign in, go to the sign in with login.gov account, which will walk you through setting up an account and then linking it to your ITA account. Okay. And then if you have any questions, there's a frequently asked question button here. So this button has some useful answers, Say, for example, you have more than one user at your facility that you want to enter data. You can set up a multi-user, you connect multiple users to your account. It tells you how to do that. Let's say the resource who did this for you in past years is retired or moved on or is not available for whatever reason. It tells you how to recover your account. It's a useful link if you have any particular problems with your account. Okay. So next three steps. So on the create account screen, you enter your email address, you select your email preference, you have to read and acknowledge the rules of use, and then hit the submit button. Login.gov automatically emails you a hyperlink. So this is an important step. You get a 24-hour hyperlink just to verify that you are who you say you are, that comes to your email account. And so you have to go to your email, click on that hyperlink to finish setting up your account. And then there's an authentication method screen. So the login.gov uses a two-factor authentication just to keep your account secure. Most of you probably choose a text to your cell phone. It's the most common way. They ask you for also a backup authentication method. But so that's the next step, is just to set up a dual authentication. 7, 8, 9, follow the steps on the screen. Okay. Once completed, your login.gov account will be created. Select agree and continue. And at that point, you'll be redirected to the ITA login.gov entry screen. Select the login. So at this point, if you already have a OSHA electronic reporting account, it should link. You shouldn't have to re-enter your the data for your establishments, just the annual data for your injury, from your injury and illness 300-day. So that's it. Once you have this set up and you want to access your account in the future, you can just go to login.gov, log in, and down here at the bottom, there's your connected accounts cell button. So you click on your connected accounts, and your ITA account will come up as an option there. Other ways to get there. Right now, when you hit the OSHA homepage, because this is a new thing and it's active at this point, right now the OSHA.gov homepage opens right up to a blurb about the ITA, and you just can click on learn more. So that's one way to access your account. Now, I've checked with OSHA, and this screen isn't going to stay the same until March 2nd. So don't count on this method, or set up your account right away rather than waiting. But if you don't have the option just from the home page, you can just go right up here to topics and do the drop-down menu. On the drop-down menu, you'll see record keeping requirements and forms. Click on there, and again, it's going to give you access to the ITA system. Okay. So that's how you create your new login report. Very simple, nice instructional material from OSHA, including about a 7-minute video that walks you through the same things I just walked you through. Okay, now let's talk about who's covered to submit data electronically every year. Okay, so data submittal requirements: who, when must they submit, what must be submitted, and how. We'll go through the who, when, what, where, how. So who's covered? It's easier to tell you who's not covered, I think. So the following facilities aren't required to submit. If your peak employment during the previous calendar year was 19 or fewer. This is establishment-wide. Let's come back to that in a second. So this is for an individual establishment. When I say establishment-wide, this is for an individual establishment list, individual location. So if you have 19 or fewer at a location, you're not required to submit electronically. If your establishment's industry is on Appendix A to Subpart B, there are two appendices A here. So I want to point out this is the exemption that's been in place for since the beginning of OSHA, with some tweaks here and there. There are some industries that are just exempt from reporting. So if you're exempt from reporting, you're not covered by this standard. And I'll talk a little more about who's in and who's out of Appendix A in a minute and how to find it. Okay, so if you're still in, you had a peak employment between 20 and 249 employees during the previous year, and you're not on Appendix A that we just talked about, and now Subpart E, which is the subpart of 1904 record keeping requirements that talks about electronic data submission. So Subpart E also has an Appendix A. And if you're not on that Appendix A, then you're not required to report. Now, if you have 250 or more employees and you're not exempt under A, you're required to report, okay? These criteria apply at the establishment level, not the firm as a whole. The state plan jurisdictions could have some can have broader reporting requirements. So you should check with your state plan. In Pennsylvania, we don't have a state plan. We have federal OSHA. So we follow the federal rules. But if you're in a state that has a state OSHA plan, you may want to double check. And OSHA makes it very easy to double check. There's this app, also a link at the end of the presentation. But OSHA has an ITA reporting app where you just enter the state, you enter your NICS code, you entered your establishment size, and it'll tell you whether you're covered under the reporting standard or not. Very nice. So that's who. The NICS codes. So these are the ones that are exempt. This is Subpart B, Appendix A. These are the exemptions that have been in place for a long time. There are 82 NICS codes that are exempted. If you don't know your NICS code or are unsure about your NICS code, there's a link at the end of this presentation to the NAICS code handbook. It walks you down by category. It's pretty easy to hone in on your particular industry, and it gives examples of industries that fall under that code. You can always make, if for some reason you're a very rare sort of a business or you have trouble with this, you can ask OSHA, you can ask the consultation program for help with determining your NICS code. But in most cases, your industry is going to be listed in the book in an orderly fashion. You're going to be able to locate it, okay? Exempted organizations tend to be small businesses, clothing stores, gasoline stations, various kinds of services, schools, physicians' offices, dentist offices. So exemptions are, low hazard, low volume, usually small types of enterprises. Okay, so if you're a manufacturer, don't bother looking. All the 3,000 codes, which are the manufacturing codes, are covered. If you're in construction, all the 2,000 codes are covered. No use looking. If you're in agriculture and forestry, those 1,000 codes are covered. Utilities are covered. Even the 4,200. Once you start getting into retail stores and that sort of thing, the 4,200 is a wholesale trade. You're covered. Okay. So all the exemptions are outside of those codes. But the complete list is found in the regulations, Appendix A to Subpart B, not Appendix A to Subpart E, which is the next slide, at this link. Okay. I wanted to talk, actually on the previous slide, about the 20 or more employees at a facility, because you're exempt from reporting altogether if you have 10 or fewer employees at peak employment for the year at all of your locations combined. So that 10 or fewer exemption to recording your injuries and illnesses, that 10 or fewer exemption is 10 employees enterprise-wide. And occasionally I hear misunderstanding that those industries aren't covered by OSHA. That's not true. They're only exempt from the recording and the recording injury and illness requirements. If you're an employer, if you have one employee, you're still covered by OSHA and aren't exempt just because of the 10 or fewer rule for injuries and illnesses. Okay. And also, you may be required by either a written request from OSHA or the Bureau of Labor Statistics, where they're trying to improve their statistics on a certain segment. So even if you fall in one of these exempted industries, there's a possibility that you've been requested in writing to keep injury and illnesses logs for statistical purposes for OSHA or for the Bureau of Labor Statistics. Okay, and whether or not you've got 20 employees, 10 employees, all employers must report to OSHA employee fatalities, inpatient hospitalizations, amputations, loss of an eye. So a universal reporting requirement. We'll talk a little more about that in a minute. Okay, now we're moving on to this electronic reporting and who's required to do electronic reporting. Okay, establishments with 20 or more but fewer than 250 employees that fall into these categories are required to report. So again, no use looking if you're in agriculture, if you're in manufacturing, if you're in construction, utilities, wholesale trade, you're required to report with 20 or more employees. If you're not in one of those codes or one of 61 additional codes, then you don't have to report unless you have 250 or more employees. At any time you're over 250 employees and you're not totally exempted from recording, you have to do the electronic reporting. Okay, there are 61 additional codes that are required to report. These are mostly larger business, grocery stores, department stores, trucking businesses, warehousing, hospitals, residential care facilities, and other facilities that are listed. And that list appears at Appendix A, Subpart E, and here's a link to that. Okay, so when must covered establishments to submit their 300 form? By March 2nd of the year. That hasn't changed. It's been the same since the second year. So for March 2nd of 2023, it's time to enter your 2022 data. If you miss that deadline, you still have an opportunity to put your data in until the end of the calendar year. Okay, but let me mention that this doesn't exempt you from other important dates and time frame. The 300-day annual summary is still required to be completed internally and posted where your employees can see it, no longer than February 1. And it has to stay posted at least until April 30. A lot of businesses leave it up all year. There's nothing wrong with posting it longer, but you're required to have it posted February 1 until April 30. So I think it's a great practice. As soon as you have your 300-day filled out, which you can do now, as soon as the calendar year is over, go ahead and submit your data into the electronic reporting if you're required to, just so you're not in a rush at the end and there's not a huge demand on the system, which slows it down at the end. Okay, some other important time frames to keep in mind. The recordable injuries have to have a report, an accident investigation report or an accident report filed internally and be listed on your 300 log as soon as you within 7 days of being aware of the injury. Okay. If you have a work-related death, of an employee, you have 8 hours to notify OSHA. You can call your local OSHA office. There's an OSHA 800 number that's manned 24/7, and there is you can report online on the OSHA website. There's a link for that. Okay. And if anytime you have an inpatient hospitalization, this is admitted to the hospital, overnight stay, not just sent to the emergency room for evaluation. Anytime you have an inpatient hospitalization of 1 or more employees, anytime you have an amputation, even a fingertip without bone, anytime you have what a medical professional classifies as an amputation or the loss of an eye, there's a requirement within 24 hours that you notify OSHA of the incident. Okay. What must covered establishments submit? So you just submit the information from your OSHA form 300A, and we're going to talk about the forms here next. Okay, how do I submit? The easiest way, the way that almost all of you are going to submit, is just get into the website, click on Create Establishment, to fill out the two forms. One's an establishment form, and then the other is your data. Your establishment, if you've done this in the past, should already be in there. So you just enter your 300-day data. Once the establishment information is entered, you only need to click on the View the Establishment List, provide the new 300-day summary data. Now, you can upload it, what do they call them? A CSV file, data filed, if you have multiple establishments that you're reporting. So if you're a huge business with a lot of establishments, you may find this easier. If you're a consultant that does injury and illness reporting for multiple clients, maybe you find this easier. So that's an option, but the vast majority of you are just going to enter your data on the site. And also, if you have an automated record keeping system, you can set up an interface and just download your data. Again, these are for very big users. They don't make any sense for most businesses, not just to enter their data manually. Okay, so that's the revised process. That's the who, what, how, when, what of submittal. And now let's just talk briefly about recording injuries and illnesses. Okay, so there are three basic forms. Form 301 is just the incident report. Okay, you're required to have an incident report, and in almost all cases, your workers' compensation insurance form is going to have everything that's on the Form 301 and more. So in the case where you've personally determined that the 301 form is equivalent to another form that you're using, you can use the other form. You're not required to keep redundant forms. Once you fill out your workers' compensation report, you're not required also to do a 301 report. So in most cases, we don't see 301s. We'll see workers' compensation forms. Again, as I mentioned, these need to be completed within 7 days of recognizing the incident. The second important OSHA form is the OSHA log. This is the log of work-related injuries and illnesses. It's just a running list of any recordable injuries or illnesses you've had for the year. We'll talk a little bit more about how you fill this out. But again, once you've recognized the incident is recordable, you got to get it on the log within 7 days. And then finally, the main topic of this webinar is your Form 300A. It's the summary, the annual summary, year-end summary of work-related injuries and illnesses. All these forms are available on the OSHA website, both in an Excel spreadsheet form or a PDF fillable format. The PDF fillable format comes with a nice instruction guide that covers most situations and provides instruction on how to complete the forms. Okay. So a recording, you have to record any death. You have to record any loss of consciousness. These are recorded. This is sort of a list of recordable accidents. Any accident that results in days away from work. Any accident that results in restricted work activity or job transfer because the injured worker is not able to do their regular job. You have to make some concession. That makes it a recordable injury. And any medical treatment beyond first aid. Okay, so medical treatment beyond first aid, just because you sent an employee for a medical review doesn't mean the accident's recordable. If the employee only receives first aid, a Band-Aid, some disinfectant, eye flushing, if it still qualifies as first aid, you don't have to record it. Now, once it gets to medical treatment, and some are sort of black and white, sutures. Anytime you have to close a wound with sutures, anytime you break a bone and break a tooth, these have to be these are medical treatment. Now, diagnostics aren't medical treatment. If you send an employee, they get X-rayed, but the X-ray comes back with showing no damage, no broken bone. That's not medical treatment. That's just diagnosis. So And there are all sorts of questions that have come up about, when the incident occurs. Is it work related, or is this sort of an injury recordable or not recordable? So OSHA has answered dozens and dozens of questions like that. There are these great letters of interpretation. Your situation could very well be covered by one of those letters of interpretation. So if you ever feel like you're in a gray area and you need some guidance, again, this website, the Record Keeping Interpretations, is in the list of useful websites at the end of the presentation. So any significant work injury or illness that's diagnosed by a physician or other licensed healthcare professional, including work-related cases that involve cancer, work-related cases, chronic irreversible disease, fractured or cracked bones, I mentioned, punctured eardrums, contaminated needle stick, removal under the requirement of an OSHA health standard. Let's say you've got a chronic overexposure to lead to the point where you have to, remove an employee from, a job or an area of the plant. Any of those have to be recorded. Tuberculosis infection and hearing standard threshold shifts are all recordable injuries or illnesses. Okay. Here's the 300 log that I mentioned you need to fill out. Some specifics on that. So for every injury, you enter a case number. I get questions sometimes about that. There's really no magic to the case number. A lot of companies just use 1, 2, 3, 4, 5, 6. They just have to be sequential so that you can see that all the injuries are on the log. Some people use the year as a preference. It'll be 23-001, something like that. However you do that, as long as it's sequential, is fine. Employer's name. You put the employee's name, but there are privacy concern cases. So a 300 log is available on request to an employee or employee's representative. And so you can see that in some cases, the injured employee may not want their name to be on the log. Those are privacy concern cases. So anytime there's an injury illness to an inanimate body part, you can just list the privacy case. Injury illness resulting from sexual assault, mental illness, HIV infections, hepatitis, tuberculosis infections, needle stick injuries, or anytime an employee independently and voluntarily requests that their name not be entered on the 300 log, you can just enter privacy case, but you do have to keep a separate confidential list of the names of the case numbers and the employees' names so that it is possible under confidential circumstances to link a privacy case to a name. Okay, they put in the job title, put on the date of the injury or the onset of the illness, and where the event occurred, and describe the injury. Now, in injury description, the consultants are often reviewing 300 logs, and there's often a question whether or not an injury should or should not have been recordable. So if there's a trigger that makes this injury recordable, laceration, required sutures, X-ray, broken bone. So it's good to describe in the injury or illness the trigger that makes it recordable. It just makes it a lot easier to review your form. And a year or two later, when you're going back, looking at trends, looking at your data, it makes it easier for you as well to kind of sort of reconstruct that incident. Okay. Rest of the 300 logs, another thing that we often see, you use the most serious classification only, and especially in days away from the job and job transfers or restrictions. A lot of times we'll see a log where both days away has been checked and also job transfer, because both things happen. The employee was off for a while and then they came back but weren't able to do all the duties that they had been doing before the injury. So in that case, you only mark the days away, the more serious one. But then when you record the days, you can enter days, even though you've only checked this box, you can still enter days under days away from work, and then enter the number of days the employee was also transferred or restricted due to the injury. Okay. And then you also just classify whether it's an injury or some sort of an illness hearing threshold shift, whatever, whichever category you fall under. Okay, so on the annual summary form, things we often see, remember to enter the year. It's a requirement. There's a place to enter the year up here in the right-hand corner. And we'll often see forms where the year isn't entered. And then if you're required by OSHA, by the way, to keep these forms for 5 years when OSHA consultation comes in, or if you get a visit from OSHA, we look at these forms. OSHA is going to look at these forms. And sometimes it's really hard to reconstruct these if the years aren't marked. Okay, have to match them up. There are usually years on the 300 logs on the dates, but sometimes people just an employer will just enter the month and the day on that. So always enter the year. Make sure you're using the proper NAICS code. We often see errors here, especially because of the transfer from the old SIC codes to the NAICS codes. People are it's not uncommon to find an employer is confused over the NAICS code. So there's a link at the end of the presentation that will to an NAICS handbook, and finding your code is pretty straightforward because they're laid out in a very orderly fashion. Okay. Another thing that we often see is either the safety coordinator or HR representative has signed the form and the signature block down here. Be aware that OSHA requires that the highest ranking company official working at the establishment, so your plant manager, your owner, or that person's supervisor, if you're in a larger corporation, or an officer of the corporation, or the owner of the company, has to be the signer on this. So often it's your plant or operations manager that signs off. OSHA just wants to be sure that that upper management is aware of your injury and illness summary. No blank spaces. A lot of times we'll just see a number of injuries here and blanks for skin disorders, respiratory conditions, poisonings, hearing loss. So put a 0 in those if it's a 0, and all of these blanks. If it's a 0, put in a 0. And then also the totals have to match. So your total number of cases, if you have 3 lost time, 3 restrictions, 3 other recordables that aren't days away or transfers, then that's a total of 9. Down here under injuries or in these boxes under injury and illness types, the number should be 9. Okay. You put in the number of employees, your average number of employees, that the worksheet that comes with the instructional booklet talks about how to do that number. And the more important number for establishing a rate, and we'll talk at the end of the presentation about your injury and illness rates. The more important number for establishing a rate is the number of hours worked. That's sort of the normalizer. Most employers these days have pretty good time counting measures. So from payroll, you can often get, at least for your hourly employees, a number there. For your salaried and exempt employees, you can just 40 hours a week times the number of weeks they worked is a number that you can plug in there. All employees that work for an establishment, so these days, a lot of times, a lot of us are working from home or working from home part-time, working from home full-time. Every employee has to be established with an establishment. It has to be associated with one of your establishments, and they count as an employee at that establishment. After all, I can have a work-related injury at home and I'd have to count it. You'd have to account for it somewhere. That would go on to this 300A summary. It would go onto your 300 log. So employees working from home for a certain establishment are counted as employees of that establishment. Okay. And I think that's it for 300-day summaries. Okay, let's talk just a little bit about rates. So this is just to normalize these rates, our injuries and illnesses per 100 employees. Okay, so you put in your total number of injuries and illnesses. So this is just the total number. And then also we look at days away, restricted, and transferred cases, DART. We look at DART cases and put those there. The reason we keep the two statistics is if an injury was serious enough that you lost time away from work or you had to go on restriction or transfer, it's a little more serious injury. So DART is just an index of more serious injuries. Total injuries is just total recordable injuries. So to develop your rate, you just take your total number, you divide it by 200,000. I mentioned that this is per 100 employees. So the 200,000 comes from 40-hour work weeks, 50 weeks a year. That's 2,000 hours per employee. And this is per 100 employees. So you multiply the 2,000 by 100, and you get 200,000 hours. So this is 100 standard employee years. So you take your number, multiply it by the 200,000 standard, you divide it by the actual number of hours that you show on your 300-day log, actual number of hours your company worked, and that's how you get your total recordable case rate or your DART incident rate, in case you are wondering about where your rates stand. By the way, the Bureau of Labor Statistics publishes data. They've just not recently published the data for 2021. Takes them a little over, it takes them almost a year, usually around the 1st of October, to publish the previous year's data. But you can compare your rates against other businesses in your NAICS code. You can do that on the Bureau of Labor Statistics site or on the OSHA site, their record keeping section. Okay. So that's it. Revised process for the online ITA, very simple, very straightforward. Who's covered, and just some general reminders about recording injuries and illnesses. Here are helpful links. Here's the injury reporting login. As I mentioned, there's a nice instructional video. It's just under 7 minutes. It's available at this link. If you're not sure about your NAICS code or you want to double check, the manual is available here. It's a PDF that'll download. If you want to know whether or not you're covered, there's a question about coverage. Appendix A to Subpart B, this is companies that are exempted from reporting altogether, is here. Appendix A to Subpart E, these are companies that are required to submit in that 20 to 250 employee range, required to submit, listed by NAICS code. And if you don't want to go there and look it up, there's a great app. If you know your NAICS code, you know your state, you go in and OSHA will do the work for you. This application will tell you whether you're in or out. 300 forms and instructions are available in Excel or PDF fillable format here. As I mentioned, there are a lot of interpretations which come in useful if you're not sure about the recordability of an incident, and they're available here and laid out in a pretty orderly fashion, entitled. So fairly easy to work through those to find an interpretation that'll help clarify your situation. And I just mentioned here that safe workplaces have safety committees. I think it's fairly fundamental to a safe workplace, and there are PA certified safety committees that's run by the Bureau of Workers' Compensation, that whole program. And there's a great manual that lays out how to become a certified safety committee in the state. So I throw in that link as a useful link. Okay, in case you're interested in PA OSHA consultation, you can just go to iup.edu/PA-OSHA consultation. If you just go to iup.edu and search for OSHA, you're going to find our website. And there's a nice video that talks about how to sign in. If you want to request it talks about the program. If you want to request a consultation, there's just a consultation button right here that puts you into a form to request a consultation. Our service is free, provided to small businesses. We can do some limited scope work for larger businesses. And a small business is a business with 250 or fewer employees at a location, 500 or fewer employees in the corporation. You can sign up for our newsletter. About twice a year, we send out a newsletter. And you can find previous webinars, recording of webinars, old newsletters, and many other, some training videos, many other resources here in the left-hand column. In case to contact us, you can contact me directly, rmason@iup.edu. The Pennsylvania OSHA Consultation Office has an 800 number. We have the website I just mentioned. We're on Facebook. We're on Twitter. We take turns, the consultants take turns doing phone duty. So if you just have a safety question, you need a quick answer, you can call the 800 number and you'll be transferred to one of the consultants who will answer your question for you. Okay. Good. Thank you very much for your attention. Our next webinar is going to be on common but often unrecognized electrical hazards in the workplace. That's going to be on March 15th, 10:30 a.m. So please tune in. And with that, we'll terminate this. Any of you that we didn't get answers to during the course of this webinar, in the chat box, we'll get responses to you and post them on our website here.